Hi, it's Cassandra, and welcome to Speech Secrets. Try this with me. Take a deep breath and gently release the air while making a V sound, like this. That's the beginning of a semi-occluded vocal tract exercise, or SOVT. I'm going to show you what they are and who they're for. Everyone. Well, almost.
Speech Secrets.
Semi-occluded vocal tract just means partially closing your mouth while making a sound. That can be through humming, making a prolonged V or Z sound. It can be through lip or tongue trills, or singing through a straw. SOVT exercises are commonly used for vocal fatigue, vocal strain, a weak or breathy voice, certain voice disorders such as muscle tension dysphonia, nodules, or polyps, and for people who use their voice heavily such as teachers, singers, speakers, and clinicians like me. Let's try another SOVT exercise. Take a breath in and hum at a comfortable pitch. Try to hold it for about 5 seconds. Don't force the sound. Let it feel steady and comfortable. Again, deep breath. How'd that feel? SOVTs can be used both for rehab and preventing voice problems. But if you're having ongoing, persistent voice issues, it's always best to get checked out by an ENT before starting any exercise program. So why does this help? Well, your voice depends on your breath, your vocal cords, and the way the sound resonates or moves through your throat and your mouth. SOVT exercises help those systems work together more efficiently by creating some back pressure that makes voice production easier. When the pressure above and below the vocal cords is balanced, your vocal cords come together more easily and use less effort to make sound, helping your voice be clearer and less tired. When there's a mismatch in this pressure, like too much air pressing through, your voice can sound breathy or strained or unstable, or it can be fatigued. SOVT exercises help reset those systems. Honestly, when I'm working with voice clients and doing SOVT exercises regularly, I feel the difference in my speaking voice. I can tell that I have not been doing them lately. For some people I work with, doing short spurts of SOVT throughout the day helps give their voice a vocal reset when they need it. But not all SOVTs are the same. Think of them like a spectrum of resistance. On the lower level of resistance are lip trills and humming, where not too much back pressure is being created. Medium resistance is making the sound Z or V like we did at the beginning, or using a boba straw with a bigger diameter. Higher resistance or more back pressure would be using a coffee straw with a very small diameter, or using a straw and putting it deeper in water while you're voicing through the straw and blowing bubbles. You can further adjust the pressure size by changing the shape of the mouth, the straw diameter size, or how deep the straw is in water. Higher resistance is often a good place to start, but everyone is different in what feels good for their vocal cords. SOVT exercises are very individual. The pressure has to match the voice system, otherwise it can feel uncomfortable. So how do you know which exercise is right for you? Well, after doing the exercise, voicing should feel easier, not harder. You know it's helping if your voice feels clearer afterwards, or it feels smoother when you talk with less effort or fatigue. But if it causes strain or discomfort, then it might not be the right setup for you. And that's where working with a speech therapist who specializes in voice can be really helpful. If you're looking for that one-on-one support, I've put a link for Sierra Corbin with Sierra Speech in the video description. Join me for the next video to try a follow-along SOVT routine. Thanks for watching, and be kind to yourself.